My name is Jacob Snyder, and I'll be talking about tissues and their subtypes. First off, we have epithelial tissue. It has simple squamous, stratified squamous, simple cuboidal, stratified cuboidal, simple columnar, pseudo-stratified columnar, and transitional epithelial tissue. First, we'll be talking about simple squamous. Simple squamous helps gas seep through the skin. It also helps with lubrication, filtering, and diffusion. You can find it in the alveoli, in the kidneys, and the liver. Next, we have stratified squamous. This is a picture of stratified squamous under a slide. This dark pink, those are nuclei. You can see it better on the computer, but there's dark pink circles on the slide, and it's nuclei, and this part is, stratified means it's layered on top of each other, so there's more than one layer on top of the basement membrane. And you can see in the pictures the flat cells squished on top of each other. Next is simple cuboidal. It's called simple cuboidal because of its cube-like shape. You can see the darker circles, those are your nuclei, and this is the lumen right here in the middle. They are located in kidneys and sweat glands, and their main function is absorption and secretion. Next is stratified cuboidal. Here's a little bit better picture of it with the nuclei and the lumen. It's found a lot less. It's mainly only found in your sweat glands, so it's harder to find. Next is simple columnar. Simple columnar nuclei are always based at the base, at the bottom of the cell, while the rest of it stretches out. This is the dark part, this is the nuclei. You can see that all around here. You can find it in your GI tract. It helps move things along. Find it in your uterine tubes. Pseudo-stratified columnar. Pseudo-stratified columnar, the word pseudo means false or sham. It's not actually stratified, that's why it's in front of stratified. It's just bunched up so tight together that the nuclei look like they're up top, so it's layered. It's not. They're kind of just like facing opposite, and they're like intertangled like this. Next, we have transitional epithelium. This is always found in the bladder. You need transitional epithelium to expand and shrink your bladder whenever it fills with urine or waste. That is why we have this apical dome shape always on transitional epithelium. The next type of tissue we're going over is connective tissue. Connective tissue has 4 types. It has CT proper, cartilage, bone, and blood. Connective tissue proper has subtypes within itself. This is just a list of connective tissue proper subtypes right here. Loose connective tissue proper, which is also called areolar tissue. Areolar wraps its and cushions and plays a role in inflammation in your cells. It's located under most of the epithelial tissue in your body. Next is loose connective tissue proper adipose. Adipose is just fat cells. This is what I have a picture of right here. The nuclei are these like purple little dashes lined out, and the cell itself is right here, and that's just like lipids and stuff. Next we have reticular CT proper. These support other cells like white blood cells and mast cells. And then we have dense irregular. Dense irregular is found everywhere in your skin, mainly in your dermis. It's called irregular because it doesn't have a certain pattern to it. It kind of just it stretches everywhere, so your skin doesn't rip apart when you like stand up and you stretch out. This is dense regular tissue. It has a good strength, good tensile strength when pulled one way, but it can't separate and go like every which way like dense irregular tissue. It connects muscles and bones to each other, and it can be found in tendons and ligaments. Next, we have elastic tissue. It's just dense regular tissue with more fibers in it, so it's a lot tighter. It helps with recoil and stretching. Next is cartilage. First we have hyaline. Island cartilage is where your coastal cartilage is in your ribs that connect to your sternum. It reinforces and acts as a cushion. And we also have elastic cartilage. Elastic cartilage can be found up here in your ear. That's why it bends down like this and just goes back, because it's elastic. And then we have fibrocartilage. Fibrocartilage is at your pubic symphysis, which like holds your whole body together, and it also is in between each vertebrae of your spine. So your spinal column isn't just rubbing together constantly, and you can walk on it and it helps hold it together. Next we have bone. Bone tissue is where you guessed it, in the bones. Right here we have the central canal, and then these like larger circles as a whole, they're called osteons. And the little black dashes are osteocytes. Yeah. Then we have blood. Blood cells are everywhere that there is blood. So they transport gases, nutrients, waste, and other things like that. Right here we have a lymphocyte, which is a white blood cell, and a platelet, and all these other ones are like red blood cells. Yes, it says right there. And that is my presentation. Thank you for watching.